I hate it here sometimes. Being a nurse in Nevada and in Vegas can suck sometimes. And I don't talk about it a lot because there's something to be said for don't shit where you eat, you know? But there was a bill that would give Nevada mandated nurse to patient staffing ratios. And there was a hearing last week in front of the Nevada legislature. And I called in and listened to it. It was 3.5 hours long. And I listened to the entire thing, and it was very interesting. So I wanted to talk about it. The bad thing is I couldn't see who was speaking, and so I didn't catch a lot of names. But, lots of people speaking in support of the bill, of course. Lots of nurses. The Nevada AFL-CIO was great, talking about how safe staffing saves lives and it will work. National Nurses United representative was up there. I believe her name was Renee. She was great. She talked about how, there's a surplus of licensed nurses in Nevada that are not working at the bedside specifically because of unsafe staffing ratios, one nurse after another, all these people in support, of course. And then hospital admin spoke with all the gaslighting, like all of it. They left no gaslighting behind, And the only thing this one guy was willing to concede was that, yeah, there is some research that shows that, staffing ratios will decrease hospital-acquired infections. That's it. That's all he would give. That's it. Hospital-acquired infections. But not like save lives or all the other No, none of that's the only one that he was like begrudgingly willing to admit to. And then is like, are you open to keeping the ratios flexible? No! That's the whole point. Because if we give you an inch, you will take a mile and take advantage of nurses and patients. It has to be mandated, or else hospitals will absolutely continue to get away with murder, which is what they do. Patients die every single day as a direct result of unsafe staffing. So no, we cannot be flexible. That's kind of the point, and then they would pepper in, but nurses are wonderful. We appreciate you. You're heroes. We love nurses, but we're going to fuck you anyway, And then all of the mythical problems that they say are going to happen, like units are going to close, beds are going to close, hospitals are going to close, all the things that they swore up and down was going to happen in California 20 years ago when they enacted their mandated ratios. And they said it's just too inflexible. It doesn't take into account acuity. It's going to increase costs for consumers. On and on and on with the litany of excuses. Do you know how many hospitals closed when they enacted the mandated? Zero. Yeah. But here we are 20 plus years later, and they're still regurgitating the same tired arguments against staffing ratios. And then we had, I think it was Representative Titus, but I couldn't see anyone, so I'm not entirely sure. But, oh man, a piece of work. Talking about how she was a CNA a long time ago. Yeah, 60 years ago? Okay. And, healthcare heroes, and we love you and love you. And then something weird. She's like, lighten up, guys. We're all here for Nevada. We're all here. And the good news is it's snowing outside. You know what the bad news is? The bad news is patients are dying every single day as a direct result of hospital greed, refusing to hire more nurses and staff safely. But yeah, let's talk about the snow. Okay. Oh, so frustrating. And then, the constant reiteration from everybody against it was, we just need more data. And there's a nursing shortage and we need more data. You know what we need more data is code for? It's code for deflection and stalling, because they're going to inevitably ask for some obscure data that no one has in the moment. And no matter how much you say, I'll get that to you right away, it doesn't matter, because they're trying to make the nurses that are in support of it look incompetent. We need more data is code for deflection and stall tactics. That's all it is. And there is no nursing shortage. I will say this till the day I die. There is only a shortage of nurses willing to work at the bedside. Okay, there are more nurses every single year. We're pushing like 6 million or something now. Every year the number goes up. Licensed qualified nurses that are refusing to work at the bedside. The quote-unquote nursing shortage is propaganda. Propaganda to get away with hiring and staffing less nurses. That's all it is. It's the most brilliant excuse ever invented, actually. Because all they have to do is throw their hands up in the air and say, well, there's a nursing shortage. What do you want us to do? There's a national nursing shortage. There is no nursing shortage. There are more than enough nurses to fill every single vacancy. And we would be willing to work at the bedside if it was safe. Okay. And then someone spoke up, and I don't know his name. I assume he was a nurse, but he was brilliant. It was a mic drop moment. And he said, with all due respect, you're speaking from a place of privilege. And you could hear everyone cheer in the background. They lost their ever-loving minds when he said that. They immediately cut him off. Excuse me, you are not allowed to be disrespectful to a member of this committee. And if this continues, we will have to get security involved. Like, all he said was, with all due respect, you're speaking from a place of privilege. That's it. You would have thought he cut her leg off or something. Anyway, somebody put me in touch with whoever that was because I want to buy you coffee. Like, that was so good. There were several different Chamber of Commerce people that came to testify against the bill, and they're like, yeah, it won't work. How do you know? How do you know, Latin Chamber of Commerce, that nurse-to-patient staffing ratios won't work? Please tell me what makes you an expert in this. So infuriating. And then one by one, it was CNOs and CEOs and DONs from around the state just getting up there with the gaslighting and the sob stories. Ratios will create a burden. One person said travel and float nurses are an extinct model. What? Then, my personal favorite, if you do this, the pediatric cancer patients are going to have to go out of state for treatment. And the pediatric psych patients will not be able to receive their mental health. They'll have to go out of state. Like, you had to bring in the kids with cancer to tug on everyone's heartstrings. I mean, come on. Like, it's so obvious, the manipulation. If you pass this bill, we won't be able to build the children's hospital. Like, just absolutely ridiculous. And then just with the constant, what we need to focus on is the pipeline of nurses, not ratios. The pipeline is there. The pipeline is fine because all of the different nursing programs are just like everywhere else around the country, turning away qualified applicants every semester, right? Like, pipeline is not the issue. That is deflection. One of them had the audacity to say, well, CMS already enforces care standards. Do they though? Do they really? Come on now. There was one neurosurgeon though who testified and said, I couldn't help but notice that during COVID, we had more nurses because you were willing to pay them more. See how that works? See? One of the CNOs who claimed to have worked as a nurse in California once upon a time said, when they enacted this in California, it did not increase the quality of care. Really? Have you ever noticed that, like, whenever anyone in this entire state has to have a surgery that's like anything other than maybe an appy, they want to go out of state? Why do you think that is? Because the care in Nevada sucks. Right? Like, the medicine that is practiced in Nevada sucks. But you know where nurses want to go? California. California is literally Mecca for nurses. Then the Nevada Hospital Association got up there and said it'll never work. Well, no hospital association has ever supported nurses or ratios. Ever. What does that tell you? So yeah, I probably just shot myself in the foot by saying all this, but it needed to be said.